So thank you everyone for joining us tonight. My name is Olivia Stanford. I am one of the community health educators at the Johns Hopkins Sidney Kimmel Comprehensive Cancer Center. And today we're going to have another Ask the Expert webinar. It is the first one of the year, so Happy New Year to everyone. Today we're going to talk about this topic with Dr. Marcie Johnson, clinical psychologist. Thank you so much, Dr. Johnson. It's a pleasure to have you here.
Thank you so much for having me.
Yes, it's a very timely topic, especially since during the holidays, we all feel a variety of emotions, but especially, with us discussing it in reference to cancer, it adds a different complexity to an already important topic. So, just to get started, I was wondering if you could just describe what is the connection between mental health and cancer?
Yeah, I think that's a great question. And thank you again for having me. I'm really excited to be here. Happy New Year, everyone. Given the format of the call, I can't see people's faces. So I'm operating a little bit in cyberspace, but please do drop questions into the Q&A, into the chat. I'm hoping that this can be sort of a conversation, a little bit more informal. Um, and we can really just create a space where people can ask questions and get some answers and yeah, support that's needed. So Olivia, do you want me to just jump right in or?
Yes, and thank you for saying those things because yes, please don't hesitate to drop what you said, what your questions or your talking points or even your comments in the chat, everyone, or a Q&A at the bottom. So if you don't see the chat option, there should be a Q&A for you all. But yes, let's hop right on into it because we've had some questions submitted from our out in the community. We've had people bring things up over time, and I think that's a great place to be, just right at the basics.
Perfect. So I think you said the question was sort of the relationship between mental health and cancer. Um, so probably unsurprisingly, it's an extremely important relationship and an extremely complicated relationship that there's still a lot of work being done to understand the intersections between mental health and cancer, both from a diagnostic perspective, but also from um, a coping perspective once you've been diagnosed with cancer. So there's kind of um, multiple multiple intersection points where mental health plays a big role in how somebody may cope with cancer or cope with caring for somebody who's been diagnosed with cancer. Um, the continuum of care in terms of cancer care, which we've talked a little bit about me and you, Olivia, um, includes prevention, screening, treatment, and rehabilitation and survivorship. And mental health is kind of an overlay or an underlay, whatever you want to call it, to at all of those different points on the continuum and plays an important and unique role at all of those individual points.
So if it was like a multi-layered cake, not that the continuum is, but it would be like the outer layer, like the icing on the outside. It encompasses.
Yeah, yeah, exactly. I can share my screen actually. I like tried to capture it in a visual a little bit as I was thinking about this. Um, it's nothing overly fancy, but I'm happy to share if you give me a second here. All right. Can you see that?
Yes, much better than my cake analogy.
So here's sort of the cancer continuum of care, and then we can kind of think of mental health as kind of pervasively interacting and affecting all the different points of this process, if that makes sense.
It does, it does. And I see, like you said, starting from even prevention. So by prevention, does that mean someone who hasn't been diagnosed with cancer yet? Or
Yeah, so in terms of prevention, what we mean is preventing new cases of cancer or helping exactly what you said, right? Prevention, somebody who has not yet been diagnosed with cancer. And the way that mental health tends to intersect largely with prevention is that um, there are sort of two ways in which mental health intersects with prevention. One is from a behavioral health perspective. So, mental health can play a big role in the behaviors that we engage in. And we know there are certain behaviors that can increase or decrease one's risk to develop cancer, right? So things like diet, nutrition, sleep, exercise, substance use, all of these factors are risk factors for the development of cancer. And they also all have a behavioral component. When somebody is having a mental health difficulty, they're at higher risk and it can be more challenging for them to engage in positive behavioral health activities. And that can then put people at higher risk for developing a cancer later in life. So that's sort of the behavioral pathway that that we think about in cancer prevention. The other pathway in terms of how do mental health challenges sort of affect cancer development is from a more biological perspective. And this idea that those who undergo significant stress or are exposed to chronic stress and chronic stressors, that could be early childhood stress or stress throughout development in some way, that can also put you at higher risk biologically to develop cancer. We know that the human stress response is a cascade of hormones and events that then changes the actual cellular makeup of our bodies and can put us at higher risk. So we have, in terms of the prevention piece, prevention from a behavioral health perspective, and then also prevention from sort of a more social determinants of health perspective, where we really need to address environment and social circumstances to minimize stressors.
so I I really appreciate you just breaking down every aspect of, like you said, there's a biological and then there are some behavioral things. And I definitely want us to go over that some more. I do see we have someone put something in the Q&A. So the Q&A, they asked, can you comment about how if individuals are dealing with mental health issues, they may not adhere to or pursue preventative screening options?
Yes, absolutely. So that sort of falls under that umbrella of behavioral health. And mental health problems, there's a known association between mental health problems and poor health behaviors. And people um, are who have mental health challenges may be less likely to adhere to what their doctor has prescribed, or to seek screenings, or to seek preventative care, to regularly attend their PCP appointments or their annual appointments with their, gynecologist, or whoever it may be. When you're dealing with mental health concerns, including things like depression and anxiety, that can be a barrier to getting care. Did that answer that question? Is there a way for me to see the questions as well? Oh, okay, here. Yeah, I pulled it up. There we go. Um, yes. Okay, perfect.
Thank you, Dr. Johnson. Yeah, no, I can just imagine like it's already one thing just trying to get through life. Life is lifing. And then, like you said, you have to adhere to things. And that can't be easy. And like you said, exacerbated whether someone is diagnosed or not, treated or not, to then add on any sort of other diagnosis that impacts their health in a different way. So I appreciate you touching on that. It sounds like it would be simple, but it's so not. It's not. And so,
Yeah, and then I mean, even more broadly, right? Like if you think of behaviors that aren't even directly related to like screening or getting health care or anything like that, people who are dealing with mental health challenges, right? They also may be less likely to engage in health behaviors like exercise, or engage in self-care, or engage in healthy nutrition. And as we said, all of these things, right? It's an intersection of all these different factors that play into the risk of developing a cancer.
yes. So really quick, if you have those stats or a general estimate, how much does it increase your risk if you do have a diagnosis, or if someone has an underlying mental health condition, whether or not it's diagnosed, how much does that increase their risk of cancer or
So I don't have the exact number of like increased risk, but I there is research and evidence that depression, for example, is a known predictor of mortality in cancer. And so having depression, having a diagnosis of depression, increases your rate of, or your risk of dying from cancer. And we know that rates of depression are estimated to be about 3 times higher in patients who have been diagnosed with cancer than in the general population. So it's a significant problem.
wow. And so that goes back to, like you said, those additional risk factors of if you're not adhering to even just going to your basic PCP, your primary care physician appointments, your yearly physical, that is definitely, thank you for saying that, because again, mental health is seen differently in different cultures. And I know, like in America, we're trying our best to continue the conversation to try and make it more normalized. Like this is
Mhm.
something that is real, and it very well does impact potentially every human being at some point in their life. So thank you. So I know, please, so for those who have joined us in, Dr. Johnson has come out swinging. It is a great conversation so far. But if you were joining us in the midst of that, welcome. Thank you for coming to our webinar. And we do want to let you know that you can interact with us. There is a Q&A at the bottom. It is very much like a chat, but you can drop your questions right there. Oh, thank you. We do see people starting to do that. So please feel free to share your questions, because again, this is a conversation and Dr. Johnson is here to answer those questions and those comments. So we do have another question here in the chat. Could you give advice on how to deal with the fear of recurrence after treatment is completed? So moving down that continuum.
Yeah, so that sort of falls into our bucket if we're thinking of that continuum, right, of survivorship. And survivorship, though, in many ways starts from the time of diagnosis. And I think this is such an important question because it's really hard.
Mm,
Um, in the face of a cancer diagnosis, it is so normal to experience a range of emotions. And in that range of emotions, oftentimes there are what we might categorize as quote unquote negative emotions, although they probably serve or they do serve purposes. So it might include things like distress or fear, depression, grief, anxiety. And there also can be opportunities to experience more quote unquote positive emotions. So sometimes there's, a feeling of greater appreciation for life, enhanced spirituality or benefit finding. It's different for different people. When we talk about, fear of recurrence after treatment is completed, I think what often shows up for folks and can be a pretty common experience is a feeling of anxiety and nervousness. Because what anxiety hates most is uncertainty. And the thing that is uncertain after treatment for cancer, right, is whether or not it's going to come back. And sort of an analogy that for me at least can be helpful to visualize is that, when you're given a diagnosis of cancer, those it's almost like an earthquake, right? Like it can be this life altering, shattering event. And in the months following the diagnosis, there's oftentimes a pretty rigid series of steps that a person needs to take. There's a lot of figuring out what needs to happen, figuring out what your treatment plan is going to look like in that acute phase, right? And then kind of executing one step after another. And then after active treatment, there can be an expectation that, okay, like great, you did it. Now return to normal. Like go on, live your life. And I think that expectation is unrealistic for many people. I think that in that period after active treatment, what many people experience are almost like the aftershocks of the earthquake. So you've had this earthquake, and then things have kind of, right, the dust has settled, but there's still that aftershock. There's still those vibrations happening. And so there are definitely various ways to cope with fear of recurrence. And I'm happy to answer in more detail or give more like concrete strategies that might be useful for people. I would say though, from like a 30,000-foot view perspective, is giving yourself permission as step one to sort of say to yourself, right, or acknowledge that yes, you're done with active treatment and the uncertainty is so real. The expectation to return to quote unquote normal or who you are before the diagnosis, you may never be that person again. And so giving yourself space to learn what a new normal looks like for you, I think can be a really workable place to start for people because then we can say, okay, in my new normal, how is this fear serving me? or how is it not serving me? Because, right, a healthy dose of fear, like, we want to be in tune with our bodies and know, know sort of what is normal, what's not, know when we want to get follow up, when we think we can wait it out. You know, fear can guide us and can be really helpful. So I think thinking about asking yourself, in my new normal, what serves me can be a helpful starting point.
Everything you just said, everything you just said. I'm over here just, you've approached this. First of all, thank you for your question. Our audience, our people who are watching, thank you for that wonderful question, because the things that you just said, Dr. Johnson, from I didn't even I wouldn't have thought, like you said, there are positives that can be considered from an initial, like you said, the relief, the of knowing the truth, of getting the treatment, of, you said, a more appreciation for life, which is something so small that in our hustle and bustle world, I wouldn't have thought that kind of positive could be found in this experience. And then you said the earthquake and the aftershocks. And I think that that is such a strong image. And like just the way you said, to give permission. And I totally took from that truth. I heard give yourself permission. And yes, with fear, give yourself permission to feel and express those things. That can be applied to a wide range, again, across that continuum, just staying in the conversation, giving yourself permission to feel at those different parts of life if someone is on that continuum. So I really appreciate you and how you broke that down. I do hope that she answered your question in the audience as well. Ooh, we see, this is what I talk about, having a great time, Dr. Johnson. Yes.
Yes, no, I think it's a really important question. Also, I'm hopeful that you can not hear my 2-year-old having a tantrum downstairs. Just, I apologize if there's any like residual noise coming.
No, no, you are a-okay. And that's him or them regulating themselves.
Yeah.
So go, young human, you got this. You got this. So thank you. I see some other people have joined. Welcome. Thank you so much for coming to our talk. Dr. Johnson just laid out the truth, and she laid out so many great talking points for us. So thank you for all who've been tuning in and those who are just getting here. Please, if you have any comments, if you have any questions for Dr. Johnson, here at the bottom is a Q&A. And you can put your comments and your questions and maybe some concerns you may have for Dr. Johnson there. So Dr. Johnson, I just wanted to, we've talked about the prevention part of the continuum. We've talked about that last question. You kind of actually took us across the continuum of survivorship, but I did want to briefly touch on that end part, the rehabilitation, but also caregivers. I wanted to talk about not only the rehabilitation part of cancer survivorship, but the people who are surrounding them, the caregivers. What is known about being a caregiver, a loved one, and how your life will intersect with mental health and cancer there?
Yeah, so caregivers play a huge role, especially in our healthcare system. We can kind of think of the healthcare system as a three-legged stool where one leg is the provider, right? The professional provider, nurses, doctors, CNAs, things like people like that. Um, the patient themselves, and then the informal caregivers like family, friends, etc. And without any one of those three legs, our stool isn't gonna be steady. Um, so caregivers absolutely play a critical role, and there are so many ways, both in terms of the care that caregivers give, right? That there's, of course, a mental health perspective there in terms of, the interaction, the relationship with the loved one, because oftentimes it is somebody that you have an emotional connection to. And anytime that roles are changing or relationships dynamics are shifting, that can be complicated. Um, and then, of course, the self-care of the caregiver themselves. Because taking care of somebody can have a can take a big emotional toll on a person. Um, so in terms of caregivers, I think there are a couple different things that I just would like to touch on if that's okay. Um, so like I said, I think on the one side of things, right, we want to think about as a caregiver, how do we support a loved one who has cancer? So supporting somebody who has cancer can be extremely rewarding in many ways and extremely challenging. And support can look really different and varied depending on circumstances. So maybe we're offering emotional support, or maybe we're offering practical support. Either way, caregivers are playing this really big role in the care of a person who's been diagnosed with cancer. In terms of offering emotional and practical support, I think one thing that can be important to keep in mind is, again, working with the person that you are giving care to as a teammate. So, kind of taking the perspective of joining this person's care team in a way. This can be really challenging, especially when there are multiple roles, right? If there's a spouse or a sibling or a parent or a child. And it can be helpful, though, to make distinctions as much as possible. Of course, there's going to be overlap because we're humans and we're not that good at compartmentalizing. Um, but being able to make some distinction of, okay, my role as a caregiver, as a person on this person's care team, what is this person asking of me, and what do I have to give of this person? And I think it can be really helpful to have almost like preventative or prophylactic conversations with the person, if they're able to, that you're providing care to really discuss, like, what is it that the person is wanting or needing from you, and what is it that you feel that you're able to realistically give to them in order to kind of strike that balance. um from an support perspective, right? Maybe somebody is just wanting you to listen to them. Maybe the person you're taking care of, right? Like they don't actually want a solution to whatever the problem is. They just want you to listen. Or maybe they do want a solution, but there's no way for a caregiver to know that unless you're a mind reader, which if you are, back channel me, and like that's super cool. Um and a back channel Olivia too. Um, right? So having these conversations about, hey, when you come to me, after an appointment and you're crying and you're really upset, like, do you just want me to listen to you, or do you want to problem solve? Like, can we maybe come up with a communication strategy that we can iron this out so that we're giving and receiving in synchrony, right? Because if you're giving something that somebody's not ready to receive, that's not going to be helpful. And if you are unable to give the thing that a person is needing, that's also not going to be helpful. So I think, right, thinking about, okay, is this a point of time where somebody just wants to be heard? I just need to acknowledge, validate their feelings. Or is this a situation where they really are looking for like some problem solving and strategy building? Um, no matter what, right? I think the purpose is to help the person feel less isolated and feel understood and feel supported emotionally. So that's sort of from an emotional support perspective. From a practical support perspective, it can be really helpful to offer concrete practical support. When, from a behavioral standpoint, breaking things down into small, achievable, manageable goals is one of the best ways to accomplish things and move forward, right? Take one step, take steps in the direction that you're wanting to move. And it can really ease a person's burden. So saying, offering to do concrete things. I'm going to prepare your meals for you on Mondays, or I'm going to set up a meal train for you, or hey, let me come over and do your laundry on Wednesdays, right? Of course, honoring boundaries. If a person's like, no, I don't want somebody else doing my laundry, that's personal, like honor that boundary. And it can be really helpful to offer concrete support rather than that more sort of nebulous, like, anything you need, let me know, let me know what I can do, which of course comes from a good place. And when a person's in crisis or in a time of overwhelm, just taking something off their list for them can be really, really helpful. Um, Again, right? Always important to honor boundaries. Um, Especially when it comes to medical decisions and things like that, important to, as much as possible, depending on circumstances, allow the patient to maintain their autonomy and dignity. So much is out of a patient's control who has cancer, and it can be really important to maintain what is within their control, for them from a healing and psychological perspective. Um, Sometimes sharing an opinion, if you don't think that it, I think it can be helpful to pause before sharing an opinion. It's what seems like a very easy strategy to do, but most of us are not very good at before we share our opinion, pause and ask ourselves sort of, what is the function of sharing this opinion? Is it really to serve them, or is it to serve me? Is it because I'm anxious about this or I'm worried about this and I have the urge to tell them? Or is the function, I want to share this with this person because I think it could be important, even if it makes them uncomfortable or they disagree with me? So asking ourselves those questions in those moments of pause can be really helpful. So that's sort of the, I'm sorry, that was a long and rambling answer, but that's sort of the like offering emotional and practical support from a caregiver. The other side of things then is the emotional toll on caregivers that caring for a patient with cancer can take. Um, do you want me to jump into that at this point, or do we want to pivot to other questions? I see one in the Q&A.
Um,
Tell me what works best.
So that question will take us to a slightly different part of the cancer care continuum. I like using this, like the continuum image is kind of like a way to organize. So if you can quickly touch on that other point, then we can address that other question, but definitely do please touch on that point.
Totally. Yeah, so the other side of things that I think is really important when we're thinking about caregivers, is caregiver well-being and caregiver burnout and stress. Caring for somebody, especially if you're, like I said, caring for somebody who you have some kind of relationship to, significant relationship to, like a loved one, can of course have an incredibly profound emotional toll on the person giving care. And common reactions to being a caregiver to a person who has cancer include things like anger, grief, anxiety, depression, loneliness. All of these reactions are super normal and super common in caring for somebody who has cancer. What's really important is that caregivers are able to set boundaries for themselves as well and notice when they're feeling burnt out. Because as a caregiver, you are at higher risk to develop your own mental and physical health problems. We know that caregiving is related to increased levels of depression and anxiety and other mood concerns. We know caregiving is related to increased or decreased sleep. We know that caregiver changes in sleep. We know that oftentimes caregivers are less likely to take care of their own physical health and mental health, less likely to attend their own doctor's appointments, less likely to maintain their own nutritious diet. So it's really, really important for caregivers to prioritize their mental health, set boundaries, which we touched on, right? And the giving and receiving, knowing what you are able to give and what you're not able to give, and setting those expectations and those boundaries, because in the end of the day, that's going to serve both parties better. Express feelings, it's important to take time to express your own emotional response to your loved one's diagnosis. Whether or not you express your feelings to your loved one, I think it's really relationship dependent. But I think it can be really important for caregivers to have their own support systems as well, whether or not it's a mental health professional or a support group or a, a pastor, a religious figure, whoever it might be, somebody that you as the caregiver are able to process the experience and the feelings that accompany a cancer diagnosis in somebody that you love. And then the other thing that I think is really important is creating and engaging in self-care practices. So, maintaining regular physical activity, maintaining a healthy diet, maintaining adequate sleep, practicing mindfulness. All of these things are so important for caregivers to give themselves time to recharge and heal, because even if you're not the person with the cancer, the physical cancer, right? You're still in a healing process too.
Again, taking notes as we go. And I love how, again, this advice related for caregiving, it can be applied to taking care of a friend or a loved one who is sick, or maybe they have a different kind of condition, but just essentially this being aware, communicating, respecting boundaries. You've really brought up, those are like the repetitive words that I was hearing. And I love how you gave practical advice too that can be followed, how you said give concrete, practical support. So you said breaking them down into small, achievable, and attainable goals, which I love because with the new year that just passed, I set the biggest goals for my resolutions. So hearing that for in this context, this is a skill that we can apply to other areas. I'm really glad that you touched comprehensively on our caregivers, because like you said, these are oftentimes people who aren't always getting paid. And it is oftentimes intersected with those different identities of maybe being a spouse, family member, or other loved one. So thank you for touching on that so comprehensively, Dr. Johnson.
Of course.
So we do have a couple more questions in the chat or in the Q&A. So before we get to the end here, everyone, we thank you for tuning in, whether you're just coming in now or you've been here from the beginning. You do have an opportunity to drop your questions in the Q&A at the bottom for Dr. Johnson. So our next one says that for the treatment part of the spectrum of cancer care, can you comment on on the impact of a newly diagnosed patient feeling isolated and how they can provide support for this reaction?
Yeah, I think this is such an important question because feeling isolated and lonely in the context of a cancer diagnosis and in the context of cancer treatment is extremely common. Um, and we also know that can be negative effects of social isolation and loneliness on physical and mental health. Um, I think what is extremely important to keep in mind is none of us know the exact experience anybody else is having. So, the best that we can do is be open and curious. And I think one way to combat feelings of loneliness and isolation, if I guess to clarify the question, are we wondering more like if you know somebody who has cancer and are worried about their isolation or feelings of loneliness, or if you yourself have been diagnosed and are in treatment and are feeling lonely and isolated? Or I can touch on both of those things.
Um, I think I think we'll have time for you to briefly touch on those things. Yes.
Okay. Um, yeah, so to provide support to somebody who is feeling isolated, I think it can be really impactful to validate their experience, normalize what they're going to within while recognizing that you may not completely understand. And I think the transparency and the vulnerability that comes with acknowledging that, like, they're going through a really tough situation that you can't totally understand and you're there for them can be really, really impactful and meaningful. I think oftentimes when somebody we love is feeling isolated or feeling alone, we want to go into problem solving mode where how do we fix this for them? And sometimes that can actually kind of paradoxically have the opposite effect of what we're intending, that it can make people feel more a person who is feeling isolated or socially alone, right? Feel even more isolated or more alone, because again, you're not giving what they're needing in that moment, not with ill intent by any means, but there's a mismatch between what's being given and what needs to be received. Um, Sometimes doing less and just being there, being physically present is more. um, Sitting with somebody, watching a show together, doing, you know, hanging out in the same space but doing separate activities, being alone together can be really helpful. I think also encouraging people to reconnect with activities that bring them joy can help combat loneliness. We can feel lonely even when we're surrounded by lots of different people, and we can feel totally content even when we're all alone. And so leaning into the things that make us content even when we're alone. So maybe it's taking a walk, maybe it's taking a long bath, maybe it's reading a good book, maybe it's watching videos of like gorgeous views, maybe it's listening to rock and roll. Who knows? Whatever, brings you that person joy, encourage that, and encouraging a reconnection to that can be extremely useful. um I think that answered both of those perspectives.
You did excellently. In fact, the person who asked the question said, thank you, very helpful. And again, just all the things that you're sharing can be applied in so many ways, just sitting with someone, being present. And what really stuck out to me was when you said, I don't know the full scope of what you're going through, but I am here with you. That, as someone who I am a people pleaser and an introvert. So when my loved ones, like you said, they say something's wrong, or if I find out, I instantly want them to be back to their best self. Oh, let me do all these things. But like you said, that that can have the opposite effect, and that is very true. So I love that that's a way for the caregiver, the support person, to be vulnerable, but also to be in that vulnerability strong with them, to be however they're feeling. They don't have to be strong, but however they're feeling, just to be there. So that is something I think we can all apply. We can all be there for each other more, especially however we're feeling. So thank you for that. Definitely you answered that. So another question. So we are coming down to the last several minutes. So this is your chance. If you haven't had a chance to put your question in the Q&A, please feel free to do so. One question I want to ask, and then we will end, Dr. Johnson, just in case in the next question I get more, just I'm loving this conversation, but I do want us to end with some action items. So like some resources or tips for resources. So that will be the last question, keep it in the back of our back pockets. But the next question does say, what are some ways for our underserved citizens to address their mental health concerns?
Yeah, I think this is a really important question, and thank you for asking that. um there are significant disparities in across health and mental health that are related to a variety of factors. Um, Oftentimes, our underserved citizens have less access to care, and that can be a significant problem, especially in the context of mental health, where providers in private practice may or may not accept insurance. Um, People may or may not have insurance, and it can be quite difficult to find a provider who accepts medical assistance or Medicare. Um, there are resources, and I'm happy to share them for our underserved citizens, different community-based organizations, um, different online platforms that can help try to match you to a therapist who may be able to provide like a pro bono or a sliding fee scale, um, things like that. I would say probably the best resources for our underserved citizens are if you do have a primary care physician that you see regularly, that person, I like to kind of think of healthcare as a bicycle wheel. And at the center, the hub is your primary care physician. And then we have spokes going off to all the different kind of specialties. So neurology, OB, whatever it may be. And psychiatry and psychology is one of those spokes. So if we think of our PCP as the hub, can be a good first place to start to help us connect to resources. The other The other community resources that I think can be really helpful are through churches and religious organizations. Oftentimes, they have community health workers or community health ambassadors or different programs, or just have a really good pulse on like who in their community is offering various services. So that can be really helpful. Um, Libraries and senior centers can be really helpful places to talk to a social worker who can help connect with resources. So it's really trying to connect with resources through these different systems that exist, and it's not easy to do. It's not, unfortunately. But I do think at this point, I think we have a lot of room for improvement in this country on how to serve our underserved citizens to address mental health. I do think at this point, if you're able to connect with a community health worker or your church or your senior center or your library, those can be really good places to start.
Thank you, thank you, thank you. And you touched on one of my favorite places. I'm a book child, the library. It's free, it's there, and it's open when sometimes other places aren't. And it's a free resource, a hub of free resources. But I thank you for touching on our community health workers and community health advocates. They're such pivotal people in not only the health system, but in just every social network. So thank you. And you kind of touched on the last thing, which were some action items, some resources. Definitely, please, we will more than appreciate those resources, Dr. Johnson, and we will also email it out to everyone, and we will make those available via email, whether you attended tonight or if you're watching this in the future. And if you do want this information, please email us at Kimmel, COE, at jh.edu. Again, that's Kimmel, COE, at jh.edu. And we will send you these resources from tonight's webinar, whether or not you're watching live or watching later on. Well, Dr. Johnson, is there anything else you'd like to add before we end tonight?
Um, I I think that hopefully that was useful to folks. Thank you everybody who submitted questions. And I am always also available for follow-up. You can either reach me through the folks at Sydney Kimmel, or at mgg@jhmi.edu, which is Medicine for the Greater Good. Um, Mental health and cancer, obvious or oftentimes we don't necessarily think about the mental health component of such a physical diagnosis. And it can be extremely, or not it can be, it is extremely important at sort of all the steps, all the stages of the continuum that we talked about. There's research that shows that people who seek mental health care actually have better outcomes in terms of quality of life and survival rates from cancer. And it's not strictly biological or physiological. It's not strictly behavioral. It's not strictly social determinants of health. It's all of these things all together, which makes it really complicated and really important. So I appreciate that opportunity to come and speak about it and sort of talk about some of these important points and connections.
Oh, thank you so much, Dr. Johnson. Again, what a way to start the new year, talking about so many great points. Well, thank you for your time and thank you everyone who's tuning in. Please definitely reach out at MGG or what's the website again? Let's drop it real quick. What's your website again, Dr.
Oh,
Marcie?
oh, that's our email. It's mgg@jhmi.edu. If you send an email and just ask for Dr. Johnson, it'll get to me.
There we go, everyone. So that's their plug. And our plug again is kimmelcoe@jh.edu. So thank you so much for joining us, everyone. Have a wonderful day, a wonderful night, and Happy New Year.
Happy
Bye.
New Year. Thank you.